Hi, Dr. Ron here, and I want to invite you to join our Unstress Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstress Health Advisory Panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstress Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstress Health community. If you're watching this on our YouTube channel, click on the link below or just visit unstresshealth.com to see what's on offer and join now. I look forward to connecting with you. Hello and welcome to Unstress. My name is Dr. Ron Ehrlich. Well, today we continue a theme which I think is relevant to absolutely every one of us who ever comes into contact with a health professional, let alone if you are a health professional, because it is my belief that the epidemic of preventable chronic degenerative diseases, both physical and mental, that we have in our Western world is a reflection of the health of the practitioners which delivers that. And that says something about the system rather than the individuals themselves. So this is a great conversation today about so many issues which are relevant to us all. My guest is Dr. Lorre Laws. Now, Lorre, L-O-R-R-E, Lorre Laws, is a nurse scientist, and she's also a trauma and burnout expert. And we talk about all of those things today, what they mean on a level that I think you will find very interesting. She's also the author of Nursing Our Healer's Heart, a recovery guide for nurse trauma and burnout. But as I say, you could substitute the word nurse for you or yourself very easily here. I hope you enjoy this conversation I have with Dr. Lorre Laws. Welcome to the show, Lorre.
Thank you so very much for having me. What an honor to come together in such a beautiful virtual way from different parts of the planet.
Exactly. Now, listen, burnout is a big topic, and we've been exploring that theme on the podcast in the last few years. And I have a sort of a hypothesis that the health of the health practitioner is reflected in our global preventable health epidemic that we find ourselves in. So starting with healthcare professionals is probably a good place to start, and that's what we're going to be talking about today. But I'm just interested to know what drove you to explore this, to research it, to write about it, affecting nursing worldwide.
Well, it's always, when you get to be a woman of my age, there's a lot of stories, some of them shorter and some of them longer. But the cliff notes to my long story is I started as a very young woman, a teenager actually, cleaning restrooms in a skilled nursing facility, and then got my nurse's aide credentials at the age of 15. And started facilitating end-of-life transitions for the residents who were at the end of their lifespan before I was old enough to drive or vote. And wow. So that I my healer's heart, what I call, the reason that each of us hold deep within for, what matters to us most, including our profession, because really we're all healers, parents, healthcare professionals. It just means that we're helping another along on the path to their health and well-being. And so that led me to a career in nursing, and went on to start I did a master's degree and then a doctorate degree. And I became very curious about integrative health, which is what my clinical specialty is. And I'm also an integrative nurse coach. And so I started this was prior to the events of 2020, 2021. And I was working with coaching nurses, who were experiencing burnout. And what I was learning was that they were refractory. A good number of these nurses were refractory to our normal approaches to self-caring and, mindfulness practices and so forth. And I got very curious around the literature and the narrative around burnout. So burnout syndrome was brought out in the 1970s, a half of a century ago. And the evidence base has not been materially updated, nor is it trauma informed. So that, as a nurse scientist, that gave me some good fodder for some research questions. And so I started really investigating, like, what if it's not just burnout? Like that was sort of my overarching research question. It seems to me that in 50 years that I've been around, right, from a very young woman to now, shall we say, a very mature woman, that this hasn't been materially addressed. And I see it in my colleagues and the physicians and in our home healthcare professionals and in dentistry and really any helping professional, right? And so I really started looking, and it was my good fortune. I have a background in social and behavioral sciences, and I was teaching in that college when I was doing the research for this book. So it's a multidisciplinary research project. And so I started looking outside of healthcare for solutions. And I started looking places like, neurophysiology and, polyvagal theory by Dr. Stephen Porges, of course. And then I started looking at relational neuroscience and the work of Ian McGilchrist and Dr. Bonnie Badenoch and among others. And so what I started seeing that, and then I did a symptom cluster analysis. Like, let's do a symptom cluster analysis on the traditional burnout symptoms, and then let's look at the symptoms, the immediate and delayed responses to trauma, as framed by SAMHSA, right? So let's analyze all of that. And what I found was really shocking, surprising, and also gave a little beacon of hope, is that in the good number of cases, it's not just burnout. It's occupational related traumatization, much of which is avoidable, right?
Interesting.
Yeah.
Gosh, you have said so much there that we could unpack. I mean, what a way to start a nursing career and end of life at such a young age.
Yes.
Your interest in integrative health is one that I've shared for over 40 years, and we've explored many times on this podcast. The story of burnout, I know Christina Maslach was a pioneer, I thought, in the 80s in burnout, but it was kind of a definition that has come to fruition in our modern age. You've mentioned Stephen Porges and Ian McGilchrist, both of which I'm very, very familiar with. I mean, Stephen Porges' polyvagal theory, and this is where the trauma comes in, and we're going to talk about that. Yeah. Ian McGilchrist, of course, wrote that wonderful book that I read, I think The Master and His Emissary, Left and Right Brain. So we could spend quite a good deal of time talking here, Lorre. Anyway, let's just start with, you mentioned nurse-specific traumatization. And I'm guessing as a young woman in end of life, you would have thrown yourself in the deep end there. Can you tell us a little bit about it? Because I don't think that's a term many people will have heard, but feel intuitively there's something there.
Yes. And it's so interesting because as I was doing the research for this book, I'm a nurse scholar, so I teach at a major university in the United States in an integrative health focused Bachelor of Science nursing program. So that's where the population that I work with, and you start looking at all of these factors we discussed. And as I was researching, I was like, well, as a nurse scholar, I need to have this grounded in the right philosophical and theoretical framework, which nobody else outside of academia cares about. but it does matter, for my professional role. And so as I was writing this book, which I decided to bring the research right into the living rooms of the nurses. So I wrote Nursing Our Healer's Heart, which is a book that in first person coaches nurses who are experiencing burnout or trauma through their process. And as I was doing the research and writing this book, trying to bring whatever help I could to our community, Dr. Karen Foley at Purdue University published a middle range theory of nurse psychological trauma. And it was as though the Red Sea had parted when I found that in my inbox. And so it was Dr. Karen Foley who coined the term nurse-specific traumatization, and that ground is what I grounded my research in. And so essentially, it is that, we all have, the global category of trauma. As persons, human beings on this planet, we have all experienced some degree of individual trauma. And that would be, all of the things that we all are very familiar with. And then you look at what we're exposed to professionally. It's not just nurses. I just happen to be a nurse scholar, but it relates. And then we look at, there's some unavoidable trauma exposure that we all are, that comes with the job. It's inherent. And so that would be our secondary or vicarious trauma, for example. And then there would be the trauma from disasters. And whether you have gone to medical school or nursing school or any other professional health school, you get some training in how to manage that, right?
You would hope.
Right. At least you saw one slide on a PowerPoint, maybe.
Yes.
It's sorely lacking even when it is taught, right? And tools to manage the unavoidable trauma exposure. But what's really driving nurses from the profession and other primary care physicians and health professionals of all disciplines is the avoidable trauma exposure. And, nurse-specific trauma, physician-specific trauma exposure, occupational-related trauma, right? And this would be the things like the workplace violence, right? Whether it's from patients, families, or the incivilities and lateral violence in the form of bullying and gaslighting. And then we have the insufficient resource trauma. And this is trying to practice with not enough staff, dangerous staffing ratios, not enough resources, perhaps being asked to work an unsafe number of hours or an unsafe number of days in a row. This is all trauma exposure. And then we have kind of this historical trauma, like if you think about, and I know you're familiar with this word, the generational trauma, right? That gets transmitted from one generation to another, right? It's integrated, it's encoded in the DNA, and it, depending on circumstances, those genes get turned on, epigenetics. So that's no different than the legacies of trauma that we as health providers have also, we're sort of unknowingly transmitting that integrated trauma. And it's implicit and not something you can, empirically measure, but it's there and very powerful at the same time. And then another category of sort of this avoidable trauma exposure is system-induced trauma. And this is when the system itself is the source of the trauma. And an example I give of that it's just so sad, but it is pervasive worldwide, is the uptick of violence against nurses in their professional roles. I recently spoke at a conference, 200 nurses at a national conference. And I said, how many like you, show of hands, how many like you, like me, have been kicked, hit, had your hair pulled, been spat on, been bruised, been battered, or had bodily excrements thrown on you?
Oh my God.
Out of 200 nurses, 190. My assistant couldn't even count the hands with the up. She had to switch to count the hands that were not up in the audience. And and so this is, and then when the nurse reports this, going up the chain of command in in policy, right? Reporting it to supervisor, doing all the things that you're supposed to do. The first question that most nurses are met with is, what could you have done differently?
Yeah.
Right? So now we have a traumatized nurse who is battered in some degree. And now the system, instead of having compassion and offering resources and supports and taking accountability for whatever system issues that could be addressed to prevent, we do sort of this blame the victim, gaslighting sort of narrative. And it's these types of issues that are driving nurses and a good number of healthcare professionals from the profession. But the narrative surrounding these conversations is still rooted in that 50-year-old burnout, which places also, if you look at the World Health Organization's definition of burnout, it is occupational stress that is not being effectively managed. More blame the victim, more gaslighting. So we have these social structures that are not trauma informed, that are from times long ago, right? That are embedded in our systems and our policies. And healthcare has gotten much more complicated than it was. And so we have some cognitive dissonance at the bare minimum that needs to be addressed. Yeah.
But what you are describing is we really need to take a step back even further and look at global health.
Yes.
And when we say there is an epidemic of preventable chronic degenerative diseases, both physical and mental, and the key word there is preventable, and then we look at the coalface of the people that are being asked to manage that, and that's all they can do, manage it. They're managing chronic disease. That is a soul-destroying, traumatic experience on a day-to-day basis that we've come to accept as normal. And I often say, and I've often said on this program, that if we wanted to make sense of our healthcare system or our environment or any of these issues, if we preface the word with the two words business model, then we make sense of it, but that doesn't help the health of the individual, society, or the environment. But people having to deal with this on a day-to-day basis is exactly the trauma that you're talking about.
Well, and it goes a little bit deeper than that, even though, in that if you start looking at the work of Dr. Robert Navio and cell danger response theory, so you're familiar with that as well.
I am. Yeah.
Right. So we're just getting out all of our geek flags today and flying them high. So when you start really looking at this,
but just remind our listener, just because I'm familiar with it, let's just stop there for a moment, because what Robert Navio talks about, and we've explored this on several podcasts as well with mast cell, activation, all of that problem. But let's just go Robert Navio 101, what his message is.
Well, and I'll say his message as pertains to my work, because he has a very grand message and it's complex. But as pertains to the topic that we are discussing today, is that it looks at the stressors, right, of chronic conditions and the healing process, and how that affects particularly the mitochondria, which is the powerhouse of every cell in our body. And what happens, and it just so happens that trauma exposure, psychological trauma, is one of those major stressors to the mitochondria. And then we partner that with polyvagal theory, right? And then it gets really exciting, but we'll stick with one.
We'll get onto that as well.
We'll get onto that. And so what we have is that the mitochondria become stressed, and then they become rigid. And as they become rigid and they start moving into what's known as mitochondrial dysfunction, then they cannot produce the energy that is needed for the organism under the best of circumstances, the organism being each of us, right? All of us as human beings, so we are subjected to this, and it can lead to a whole host of mitochondrial dysfunction related chronic conditions. And so then we look at the healthcare provider who has an inordinate amount of trauma exposure. And so it complicates. So now what we have are the patients and clients, those in our care, are coming to us on what might be a traumatic circumstance or situation that they're navigating in their lives. And then they're being met by healthcare providers who have had the same individual trauma exposures. And then this whole layer of unavoidable trauma exposure that comes with our jobs, right? Comes with our profession. We suffer along with those in our care. And then there's this whole other, avoidable trauma exposure. And so if you think about that through the lens of the mitochondria that are trying to produce the energy that is required to not only just be a human, but to be a health provider, right, with the unavoidable trauma, and then be a health provider with the other layer, the avoidable, then the unavoidable. It's just I call it the trauma trifecta. And this is blowing out, for lack of a better word, the mitochondria. So for healthcare providers who are out there, nurses, physicians, dentistry folks, allied health professionals, if you are struggling to get off the couch on your days off, and maybe the best you can, and I have been here, the best I can do is, no, I can't go for the hike and the picnic in the woods because my mind is willing, but my body just can't. And I can grab the remote control in one hand and I can get my phone in the other for some takeout, and just, kind of be in this sort of, what Porges would call the freeze state. It's this exhaustion that's I'm not just tired from work. Not the tired, I've had a busy work week and I don't feel up to it. This is the bone weary fatigue and exhaustion of I can't. And that is not a character flaw or a personality deficit. It is literally a function of the mitochondria not being able to produce the energy that is needed for the prolonged trauma exposure and traumatization. So that's kind of like how his work meets mine.
Well, that's a great 101 of Robert Navarro's work. And you've mentioned Stephen Porges and the polyvagal theory. And I think it might be worth also just let's talk about that, because so often when people do face a trauma, abuse, a physical attack, it's often said, well, why didn't you run away? The fact that you didn't run away condoned what happened to you. Again, another form of gaslighting. Can we just talk about polyvagal theory so people understand? Because I think this is relevant to how we approach the rest of your work. Tell us about polyvagal.
Yeah, it's foundational, truly, to my work, and really we need to be teaching this in medical schools and nursing programs. And I'm a nurse scholar and educator, and I have combed the curriculum worldwide, a number of curricula, and it's just not being taught, and so I kind of use like a stop signal here in the United States, a stoplight. We have the green light for go, the yellow light for caution, and then the red light for stop, right? Sure. And I think that's pretty universal. So Dr. Stephen Porges, in his work, he looks at the midbrain and the vagus nerve, which innervates just darn near a whole lot of stuff. I don't want to say everything, but it goes all the way down to our intestines, from the lower brain there, and then looks at what happens with the autonomic nervous system under certain conditions. All right. So green light conditions would be ventral vagal tone, which means that we are relatively relaxed, as you and I are right now. We are curious. We're able to socially engage with one another. We feel safe because we are safe. And we can, if you and I were in our practices right now, we would be able to offer patient-centered, heart-centered care in a manner that is very authentic and genuine, right? Now, we all agree that's what we want in all of our healthcare providers, right? We want to be seen and heard and understood and felt and supported. And so ideally, we would be in this green light ventral vagal, and then our sympathetic nervous system, which kind of comes online to help us manage stress. It's a short-term response. It's not intended to be a chronic response, stress response. And if we have a really challenging situation, a patient's health is changing quickly, or we experience, some bullying by a colleague, we kind of ramp up a little bit to manage the stress. And then we are intended to go back into that green light ventral vagal. All right. So that's ventral vagal tone, green light. That's where we all want to be. That's where we are in what Porges calls our window of tolerance. Right? We're in our window of tolerance, meaning we can manage the stressors and still be grounded, centered, socially engaged, and heartfelt and curious. And we can see the big picture. We can look, as you and I are talking about broad topics, and we're able to switch conversations and be very open-minded. But then what happens is that whether it's stress in one's personal life or in professional life, and that stress goes from the regular kind of day-to-day living, or kind of these blasts of short-term acute stress, right? Like, oh, maybe we have a rapid response for a patient, right? Or maybe my patient passed away, and I'm helping with the family, and those are some kind of bigger stressors that could even be construed as trauma exposures. And so, but they're still manageable. They're taking us sort of to the top of the I can manage this zone, right? But again, intended and designed, evolutionarily speaking, to be short-term responses. But that's not what we have in healthcare. We have chronic stress. We have chronic, much of which is avoidable, trauma exposure and traumatization. And so that takes that sympathetic kind of flight or fight response, right? You're either running towards the saber-toothed tiger, or you're running away from the saber-toothed tiger. Right. This is the autonomic nervous system, and it's primal, and it's kept us alive over the millennia. Right. And so sometimes a person, if they have an encounter at work with a difficult patient or a colleague, they might lean into that, maybe with a little bit of anger, a little bit of rage. They might be moving towards the stimuli, right? And then other people might move away from the stimuli, the conflict, and in more of a fear, worry, doubt, anxiety sort of way. But both of those are legitimate responses to a trauma exposure, or what Porges calls when our threat detector, pardon me, in the midbrain, which isn't really a structure but a process, when the threat detector detects that there is a threat to our danger, to our safety, whether that's in the external environment or even our internal environment, right? That we go into this trauma response, this fight or flight. And then if we have unintegrated trauma, which is another word of saying unhealed trauma, that's kind of been stored in our body from days gone by, traumatic experiences that weren't completely healed because of a number of factors, well, then those can come up, and those are also deemed as unsafe, or can be. And so we have this, not only is it what is happening in our external environment, but what's happening in our inner landscape as well can kind of turn on these green light, yellow light dimmer switches. So again, the green light is ventral vagal tone, where we're open and grounded and centered. And then the yellow light is sort of this sympathetic Like, okay, whoo, we got a big stressor here. Let's get some all hands on deck. We need to meet this, right? But then if that trauma exposure or if that stress persists beyond what is manageable by the autonomic nervous system, then we get into the red light, which is kind of the danger signal, and for good reason. And this is when that threat detector is saying, whoo, the danger is so great, the threat to our safety is so great, or the mitochondria cannot keep up with energy production, right?
Mm-hmm.
It's looking at cell danger response and kind of bringing these two together, and it's saying we're going to shut you down because we need to conserve. The body needs to conserve energy. Right? Red light means like shut down and kind of go into this freeze response, or like where you're there at work and you're present, but you're not fully present. Sometimes presenteeism is confused with this sort of freeze response, or and then there's variations, one of which many people have heard of is the fawning. So if you can't move towards the stimulus, right, you can't fight the saber-toothed tiger or whatever that represents in your workplace, right, and you're not in a position where you can flee, because we can't abandon our patients, right, that we can't do that. So we can't fight and we can't flee. Then oftentimes we fawn, which means we just say, oh yes, I'll do that, yes I will, oh sure, whatever you need, and we just sort of say and do whatever needs to be done because we don't have any other choice. And many of our colleagues are operating in some degree of what I call sympathetic overdrive. Like they're sitting right at the border of yellow and red, right? And it's like, I can't get off the hamster wheel. I can't take a restroom break. I can't have a sip of water. I cannot eat any food. And that is real because of a lot of our short resources and lack of staffing. So that is real. I'm not minimizing that. And it is also, it's a trauma response.
It's so interesting to hear you put that, because put it in this way, because so many people would have heard many times about the parasympathetic rest and digest, the sympathetic fight or flight. But this is what distinguishes polyvagal theory, is that it acknowledges this freeze response or fawn response. I love that. And from a practitioner perspective, it goes such a long way to explain why the prescription pad provides the perfect solution to people's health issues, and such a quick and simple solution. And yet at the same time, we have such high burnout rates in healthcare. And juxtaposing those two with the polyvagal theory and putting the prescription pad in the middle of all of that, it goes a long way to explain why we have a $1.5 trillion pharmaceutical industry put in this polyvagal theory response to healthcare trauma.
Right. Well, and so here's the thing that I find so curious about that is that oftentimes, and even though I'm an integrative health nursing professor, right? So I fully acknowledge that I am, that is my clinical specialty. And also that includes the prescription pad, but it's not limited to the prescription pad, right? But oftentimes, and I'm over here in the U.S., so while we do have different healthcare systems, we do share a common denominator, is that none of us have enough time or money to care for our patients in the way that we need to, because trauma healing, as you know, is a slower process of unwinding the nervous system and rewiring the limbic system. And all of these things cannot be done in a 12 to 15 minute patient encounter, right? And so oftentimes the prescription pad is the Band-Aid, right? The Band-Aid. And yes, there's utility, and yes, there is symptom relief, but then a good number of people stop there and they don't get to the root healing. right? Where we can really start getting into the chronic illness, the chronic disease, the chronic condition of the mitochondria and how they can be supported so that they can produce the energy that we need for all of our physiological functions, right? And so the prescription pad has merit, but a lot of people think that that's the end all be all, and I just will come back next month for my next prescription, and the chronic health conditions persist, and the anxiety and the sleep challenges, and the list goes on and on. And so it's taking this trauma-informed approach to self-caring and understanding how that each and every one of us has been through some sort of a trauma, and most of us many. many.
Hi, Dr. Ron here, and I want to invite you to join our Unstress Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstress Health Advisory panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstress Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstress Health community. If you're watching this on our YouTube channel, click on the link below, or just visit unstresshealth.com to see what's on offer and join now. I look forward to connecting with you. But this is why I was so looking forward to talking to you, Lorre, because it is my belief that if we can improve practitioner health, the flow-on effects to our patients and public health will be huge, which leads to my next question is, how does nursing our healing hearts, let's start being a little positive here, because there are solutions. There are solutions to these issues. Tell us about nursing our healer's heart.
Well, this is the book that I wrote, and based on I did 5 years of research across 4 disciplines, and I self-funded this research so that I could get it right into the living rooms of the people who needed it the most. Because for those of you who aren't in the research end of healthcare, it takes about 17 years from the time you do your first study until it's translated into practice and is accessible to everyone. Well, we don't have 17 years. In within the next decade, we're going to have half the number of nurses that we need worldwide. So it's like, okay, well, I don't have 17 years and the nurses don't have 17 years. So I wrote the book, and part of what I do for my professional roles, I'm a conceptual framer, which means I come up with clinical frameworks that emerge from the evidence base that can be useful in guiding patient care, right? And so this is something that I do for a living. And so looking at all of these challenges that we talked about today, it's like, well, how can we address this? It's not just burnout. It's likely, occupational related traumatization. And how can we frame this in a way that not only will be helpful, but also as an integrative health clinician, how can I leverage each person's innate capacity for healing? For within each of us resides that capacity, right? And so how can we tap into that and really help people with the healing process? And importantly, for the clinicians still in practice, how can they insulate? How can they learn to insulate their nervous system from all of the trauma exposure, whether it's avoidable or unavoidable? Doesn't matter. Our physiology doesn't care. The autonomic nervous system doesn't care if it's a saber-toothed tiger or, or a code at work that went, with a sad outcome, right? But from the perspective of our autonomic nervous system, our vagus nerve and our mitochondria don't care about those higher concepts, right? So how can we get in here and really affect healing, which in my work, healing is a repatterning in any one or more dimension of a person's body, mind, essence. And I use body, mind, essence instead of body, mind, spirit, because we have to capture also the ancestral trauma, right? That's being transmitted, and the cultural trauma and the social trauma, and so I use body, mind, essence as the broadest, most inclusive term that I can. And so that was sort of my question writing the book, is like, how can I translate this evidence or the research that I have done into a way that really meets the reader where they are in their health, in their nervous system, in their trauma response, and offer framework. And so what I discovered is that most people most of the self-care things are externals. I've got to, and they're all important. I've got to eat right. I've got to exercise. I need to be hydrated. I need to have sleep. And I say to that, yes, 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 and yes. And then I need to go for hikes, and I need to be in nature, and I need to spend quality time with loved ones. And I say yes, yes, and yes. But that's not where we start. We have to shore up the foundation. We start with the most primal and important system, which is our autonomic nervous system and our vagus nerve. Because if you're doing all of those things, all of those absolutely wonderful and correct things on a dysregulated nervous system, this is what I found with the nurses. Once we address the trauma, once they got supported in trauma healing as the foundation upon which all of those important self-caring practices are practiced, then we got somewhere. Then healing. Oh, I got goosebumps even as I'm just kind of recalling. It's so powerful, that shift when healing happens, and that's why I'm in the game. It's like that's what is the fuel for my healer's heart, is to be a part of that process. So we start with the nervous system, and so the framework that I brought forward is very simple. It's got a little formula, because how health professionals, we love our acronyms, and we love our easy to remember things. And so here is the framework. It's 3 A's plus B. So 3 A's and a B leads to little arrow, right side arrow, to the 3 R's, right? So that's sort of the thing. That's the big takeaway. That is like, okay, so what are the 3 A's, the B, and the 3 R's? What are those? All right. So quickly, I'll just cliff notes, but the first A is awareness. All right. And you and I are helping people with that today. Now they're becoming aware of what polyvagal theory is. They're becoming aware of the cell danger response theory and how this is affected. But more than that, it's an internal awareness of starting to tune in to your inner landscape, because we are so outwardly focused and thinking that the solution comes from somewhere outside. But healing is always, and this is a universal, it always is within and can be found without, but always within. So we start there and become aware of how our body is responding to stress through the lens of polyvagal theory. Where am I in my nervous system response right now? Am I green light, yellow light, or red light? Because that is the driver of what self-caring practices. So if you ask someone who's in sympathetic overdrive to go sit in meditation, it is physiologically not available to them, right? It just isn't. And so we start there. So the first A is awareness. The second A is attending. And then attending to our nervous system, attending to our vagus nerve and what it's telling us. Right. And so in my book, I offer case studies and over 100 practices and kind of an assessment matrix so people can really start to I say learn the language of their nervous system first, and then how to navigate it. Right. So that's we're still in the foundation of our house here. So learning what practices work when you're in that freeze state. Different practices than when you're on the hamster wheel of sympathetic overdrive. Right. And being able to align that. And then the third A is the alignment. And this is where we start to look at the relationship between our inner and outer worlds. And this is something that a lot of people, especially in the heat of a very busy and demanding healthcare practice, it sort of gets obliterated by the system. Right. And we're all just we're doing the best we can, and we're cracking on the best that we can, but we lose this sense of connectedness into what our inner landscape is telling us that we need, our beliefs, our morals, our values, what our healer's heart yearns for, like all of those softer kind of right hemispheric ways of being in the world. We all are kind of left shifted, to use McGilchrist's term, into a lot of left brain doing and analyzing and so on and so forth. And so this is kind of my language in a similar way of bringing more coherence in between, or correspondence in our inner and outer worlds. And a lot of times what we find is what's happening in our outer world is kind of is like a mirror, pointing us inward to where some healing shifts can be made. So those are the 3 A's, which is awareness, attending, and alignment. That's the foundation. Now we put on the B, which is balance, which is the external self-cares that we all know to do, that we've talked about, all of the wellness domains. Your physical, your mental, your emotional health, your relational health, your financial health, living your dreams, your purpose, your values, all of the things that we think of it in terms of wellness that we all know. But if we start there and we don't take care of the 3 A's underneath, that's why people aren't progressing, is because a lot of times they're not within their window of tolerance. They may be dysregulated in their nervous system, or they might be reaching for a self-care strategy that doesn't align with where they are in that, green light, yellow light, red light sort of looking at it. And so if we start with the 3 A's, and then we add all of the things we already know how to do, right? And we've aligned them to where we are, then that leads us to the outcomes, which is the 3 R's, which is first and foremost, and of the most importance is regulation. We become regulated in our nervous system. That is probably one of the biggest, this is a big claim I'm going to make, but it's truly, I think, from my research, from what I've learned, it's one of the biggest drivers of health is nervous system regulation. Because it affects nearly every cell of our body. Sure. It's certainly every system, right? And so first and foremost, we have regulation. And then we have another outcome is reconnection, because we have now reconnected within ourselves. We have connected within, we've become aware. We've reconnected with our body in a very primal way, and we are able to care for it in a more effective way in our mental health and in our relational health. And so we become more connected within ourselves, which means we're also now more connected with others. Because when you're in the yellow and red light of Porges's theory, when you're in that sympathetic overdrive, when we're in that freeze response or that fawning response, physiologically, it is social relationships are not very available to us. And that is McGilchrist's work, is that's how you can be in a room of your dearest loved ones and still feel utterly alone. Right? Because if you're in a dysregulated nervous system state, you can't socially engage and receive that, that window is closed very narrowly. Not much is getting through. And so that's where, when we start really looking at how to, and I don't use the word self-care in my work because a lot of people feel gaslit by it, but I say nurture and nourish ourselves in these ways, then we become regulated in our nervous system. We get reconnection within and with others. And then importantly, also really important, is we restore our healer's heart. Because we have nurtured ourselves and we have reconnected with our why for what matters most in our life. We're able to reconnect that to our why for being in our chosen career roles. And so that's sort of the big 3 A's a B get you those 3 R's, and you want the 3 R's. We all want those 3 R's.
And the third R is restore.
Restore. Yeah. Not only in body, mind, essence, but restoring your healer's heart. So we're not fixing anything. We are unwinding to our innate and sovereign ways of being healthy in body, mind, essence.
I love that. I love the way you've laid that out, and it's so interesting. It's actually music to my ears, because having been a holistic health practitioner, integrative health practitioner for 40 years, I was very focused on reducing the stressors, identifying them, and building up recovery by focusing on pillars of health. But as I've moved into this area of burnout and mental health in health practitioners, and for not just practitioners, but people, I realized that the mental fitness is the key. Your mind can either be your best friend or your worst enemy.
Yes.
And that's where we really need to start, because that allows us to make decisions about balance and awareness. It's really a nice structure. And I love the way you've taken cell danger response and polyvagal theory and Ian McGilchrist and packaged it all up like that. It's a really nicely put. So the concept of your repository reveal, you've just described that, I guess, in many ways.
Well, so here's this is drawing from Porges again. And also The Body Keeps Score, Van Kessel, I think is his last name, and forgive me if I've misattributed or said his name incorrectly.
Yeah.
Yes, The Body Keeps Score. So what we know about trauma is that, and I'm going to draw from Badenoch's work here also, Bonnie Badenoch, is that if we don't have the people that we perceive that we need before, during, and after a traumatic event, it is unlikely that we will fully integrate that event, fully heal that event, right? So what doesn't get integrated, I, in my work, call unhealed bits of wisdom, because they get stored in the body until such time that conditions are favorable for healing. Not forever, but until such time that healing is possible. And so where do we store as humans? Where do we store trauma in our body that doesn't get addressed at the time? We store it in our skin, our muscles, our fascia, and our neuroplexes. Right? Those are the top 4. And so that sort of gets stored there. And I call that the repository. Right. And so sometimes, let's say you and I right now, Ron, we had an emergent event that we needed to respond to right now. And you and I have 40 years of experience in completely different ways, right, of our lives. And we both had to respond to this emergency right now. And you might respond in a way that is very different. You might be the one who's running towards the stimuli. I might be the one who's running away from the stimuli, like in terms of like getting a little anxious, getting a little more inward. You might be a little more outward. And so why is that? Why is it that two people would respond so differently as trained healthcare professionals to the same emergency? Well, that has largely to do with what is stored in our body in that repository. So when your brain scans in what is happening in the event, it also is scanning what is stored in your body, right? and triangulating that to inform the response all before we can blink an eye. Right? And similarly in my body, what's stored in my repository is also getting scanned, and it's informing by what Porges calls the threat detector, right? This 24/7 surveillance system that has one job, and that's to keep us safe. Right. And so all of this is happening very quickly. And so it really depends upon what our lived experiences and how well those have integrated from a trauma perspective and what's in the repository. Now, when conditions are very favorable, and this is what I found with my nurses that I was working with who were refractory to every manner of burnout healing approaches. But when we started working here, and we worked on, focusing on a sense of safety and the 3 A's and the B and getting connected with those 3 R's and sort of this unwinding of the nervous system. And what we found is that these unhealed bits of wisdom or the unintegrated trauma would start to emerge. Now, just as a kind of disclosure, they're not always comfortable and they're not always convenient. But we keep in mind that conditions are favorable for healing, and so we lean into the healing opportunity, and really helping to integrate the trauma as it emerges, right? And so that's when it started shifting. That's when I started getting well, it wasn't me, but when those that I was facilitating, that's when they started really like, wow. I had no idea, and it sort of changed the whole self-caring approach to making it too trauma-informed. Let's make this burnout narrative trauma-informed. It's outdated. It doesn't reflect what is happening.
Yes, amazing. And the way it's so interesting again. I love this conversation, Laurie. I knew I would. I have got into integrative health through chronic musculoskeletal pain issues. And a real aha moment came to me when a mentor of mine, Dr. Janet Travell, many, many years ago, 30 over years ago, said, muscles have memory. And that memory can last a lifetime. So if you had a trauma literally a physical trauma as a 5 or a 10-year-old, and you've been suffering chronic musculoskeletal pain for 30 or 40 years, that may be the triggering event that caused that musculoskeletal problem. And yet so rarely in chronic pain management is that concept explored or understood. And again, people become gaslit by saying, look, we've taken all the x-rays and we've taken the MRIs and there's nothing wrong. You're perfectly fine. And here we are talking not just about, well, you said skin and muscle hold the memory, and that is absolutely true, but the unresolved psychological traumas that we experience, which are very personal and individual to people. What one is a trauma to one person is not a trauma to another. But I know you also talk about your innate care plan framework, and I'm guessing this would be a good time to maybe discuss that.
Well, we already did.
We already did. Yeah, already did.
Well, no, that's the 3 A's plus the B takes us to the 3 R's. But thank you, because I failed to mention that the framework has a name. The innate care plan, which would be yours, and it draws upon that innate capacity for healing. But just as a side note, you literally in the musculoskeletal, that was me. I was that child, and and to this day, I'll share that I'm 63, and I had a whole host. I had hip dysplasia that was not diagnosed until I was 9 months. It wasn't screened for at the time, and into spica casts and leg braces and corrective shoes and all of the things, and then knee surgeries later, and then knee replacements later, and so it's been this whole sequela, and to this day, I'm still releasing the trauma from the hips, from when I was an infant. and
Yes.
had been misdiagnosed over and over and over and over again, and many people with chronic conditions, because we are not assessing. We're assessing for very large scale PTSD. Sometimes some of our assessment tools capture the big stuff. I had in my life experience, and I'm open about this in my book. It's not about me, but sometimes it's helpful to share from your personal experience, that I have had such a substantial trauma history in my life, that my limbic system got injured, like
Mm.
quantifiably on an MRI. You can, like this, this became a thing we were all really curious about, right? And yet I was never diagnosed with PTSD, because the types of traumas, and we certainly are not in any form assessing for unintegrated trauma, which is what I'm pounding the drums for in my scientific communities. It's like, we need to look here with Navier cell danger response theory. And so we have just such an opportunity before us to really shift the paradigm around chronic conditions, around self-care, and what that looks like, and how we can make it more effective, to make sure that we're starting with our autonomic nervous system and vagus nerve, and also these occupational challenges of burnout and occupational related trauma. And so
Mm.
through all of the hardship, and it's it's not a lot of fun to talk about and do research around trauma. Let me tell you, I have lived this personally and professionally. It's a heavy topic, and yet through the dark clouds always is the sun and brighter skies. And this is an opportunity for us as global clinicians and scientists and health professionals to really start embodying this approach and leading the way for the system changes that need to be had, because the systems aren't going to fix themselves. we've
Right.
been around. I've been around 50 years. But we can be the change, and through us becoming as healthy and as resilient in the types of ways that we have been talking about today, then we can care, as you said, better for our patients, and we can show them the way,
Yes.
through their chronic conditions, by making sure that we are addressing that unintegrated trauma and taking this
Yeah.
different approach to where we're starting there. And then let's see where the prescription pad and the other kind of traditional interventions where they need to be, instead of starting at the traditional interventions and kind of forgetting about all of the things that we've talked about today. We got to back up our bus a little bit and take this really trauma-informed approach to health and wellness.
Mm. So this is probably a good time to say, what does nursing 2.0 look like? What does it entail?
Well, that is what, and it could be health 2.0, it could be physician 2.0 or 3,
Yes, yes. No.
wherever
Look,
we
I
are.
mean, I think we could agree that something's not working well, and if the evidence is anything to go by, it's working really badly, and we
Yes.
need to change something for the sake of not just public health, practitioner health, but the whole community. Let's talk about nursing / practitioner / health 2.0. I
Yeah.
mean, you've outlined plenty for us to think about.
Well, this is kind of my call, my global call to my colleagues in health systems around the world, because what we know what we're doing, and this is I'm quoting Dr. Don Berwick, who is co-founder of the Institute for Healthcare Quality Improvement, the IHI, right? And so in his work, which is well published, and I'm so grateful for. He said, he's right. And where it comes to healthcare quality, is that we have very, very good people working in very poorly designed systems. right?
Yeah.
And this is part of that system-induced trauma we talked about earlier. So when I talk about nursing or health 2.0, it's time for us to rethink this through the lens of all of the topics we've talked about today. And so nursing 2.0 is the professional, the nurse safety and professional well-being edition. Start with keeping our personnel, our health personnel, safe in their roles and adequately resourced, and safely staff ratios with their patients to provider, patients to nurse. I can't do a 12-minute office visit. It takes me 12 minutes to say good morning and really connect with the person in a way that they can be seen and cared for, which is why they're there. Right? That's what they want, and that's what we want as health providers, right? And so if we kind of turn this paradigm, yes, patient care, patient safety, patient outcomes, yes, all important. But again, let's back our bus up. Let's take a look over here and making sure that the providers and the nurses and the allied health professionals are safe in their nervous system so that they're in that green light, ventral vagal tone. This is the single most important thing because that's where the fewest amount of medical errors are made. Why? Because we have the capacity, the physiological capacity to see the big picture, to make the discernments, the clinical judgments, right? And not in a way that is rushed and hasty and I don't even have time to use the restroom and you want me to make what diagnosis? Right? That's a whole different way of arriving at a diagnosis than being fully present with the person, the patient, the client in your care. And right. So it's starting with the safety. We need the nervous systems of the people who are working in the health systems need to be safe. They need to feel safe. They need to be safe. And from that then comes the professional well-being, because now when the nervous system is regulated, we're not in that flight or flight yellow zone. We're not in that sympathetic overdrive going into the freeze fawning red zone, right? We want everyone to be in the green zone. That's where the patients need us to be because they're coming into our care in the yellow and red zones. So we can't somebody's got to be in the green zone and we're the providers. So we need to hold that ventral vagal tone because our patients and our colleagues, we are all, whether we're conscious of it or not, we are co-regulating with one another, right? So if you have a dysregulated health professional who's caring for a patient who is also dysregulated in their nervous system, like we need to rethink that. So that's nursing 2.0.
Lorre, what a note for us to finish on and what a message for us to leave. And I want to thank you not only for today and sharing your knowledge and wisdom, but for all of the wonderful work you are clearly doing and articulate so beautifully and clearly. Thank you so much for joining us today.
Oh, it was my pleasure, and I'd happily come back and visit you anytime. Thank you for having me.
Wow. Well, as I said, so much there. Dr. Robert Naveau and cell danger theory and mitochondria. Here we are revisiting the importance of mitochondrial function. And we've talked about this in terms of our circadian rhythm and in terms of getting out in the sun and exposing ourselves to the sun and the earth. But here we are looking at it from a different perspective. We're also touching there on the polyvagal theory of Professor Stephen Porges, Porges, and polyvagal theory, and the work of Ian McGilchrist as well, who looks at left and right brain activity and how that shapes our history and our future. Look, there's so much in that episode. The links, I would recommend you visit Dr. Lorre Laws, that's Lorre, Lorre Laws, all one word, drlorrelaws.com. Great information there. And of course, her book, Nursing Our Healer's Heart, a recovery guide for nurse trauma and burnout. And I suspect that would be of relevance to any health practitioner or individual, for that matter, who is suffering from burnout and may not have recognise the importance of trauma in that whole experience. I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. Feeling stressed, overwhelmed? It's time to unstress your life. Join the Unstress Health community and transform stress into strength. Build mental fitness. From self-sabotage to self-mastery. And together, let's not just survive, but thrive. Expert-led courses, curated podcasts, like-minded community and support, and much more. Visit unstresshealth.com today. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.